Choose the correct direction of blood flow from the heart to the lower left limb. So that has to be your leg, and actually whether we're talking about your left or your right, it'll be the same order of blood flow, starting from the heart. So we know that we are going to begin with the aorta, which every choice here has, because blood exiting the heart, that will be entering throughout circulation throughout the body, it exits through the aorta. So we know that that's correct, but there's nothing to eliminate yet because they all start with this. Now, you might note that all of the choices are the same, just in a different order, and we need to determine the correct order between the iliac arteries, the femoral artery, and the popliteal. So we could take a look at the diagram to determine which is the correct order of all of these arteries. So it might be hard to note, but we'll go through it here, that the iliac arteries, the common iliac, if you see where this is before it divides, before this division of the vessel, it's the common iliac artery, and then it divides into two, the left and the right, but iliac is the highest up, so iliac will be first. So we're starting one with iliac, and then when it divides into two, eventually as it goes down toward the thigh by your femur bone, it becomes your femoral arteries. And of note, these are very important arteries because you have your large femur bone there. If you have a femur injury, a femur fracture, that's very close to your femoral arteries, so that could become a big disaster. So that's something that could be an emergent situation that you want to note, just as a fun fact. Okay, so we know that iliac comes first, and then femoral comes next, because your iliac would be in like this region up here, and then when it divides to left and right, you would change the name to femoral, which would be a little lower around here. So we have 1 and 2, and then popliteal, your popliteal artery, you could actually check a popliteal pulse. This is actually right behind the knee. So right behind the back of your knee, then the back of your leg, that's where your popliteal would be, which means that this is lower than your iliac and your femoral, and this would be the third step. So you go iliac, femoral, and then popliteal if we're tracking the order of blood going down the leg. So the reason that the direction of blood flow would be in this order is because we see that this is the height of all of these vessels. So we start 1, 2, 3. So if we're tracking blood flow, which is going down the leg, it would be going down in that order, passing through those 3 points. And looking at the choices, we see option A has iliac first, then femoral second, and then popliteal third, keeping in mind that they all start with aorta. And in this case, option A then would be your correct choice.